Have you ever woken up feeling as though something is stuck at the back of your throat? You swallow several times, but the feeling does not go away. You cough, yet almost nothing comes up. You clear your throat, feel a few seconds of relief, and then the irritation returns. For some people, this happens only in the morning. For others, it continues throughout the entire day. It interrupts conversations, makes the voice sound rough, disturbs sleep, and creates the constant temptation to cough or clear the throat. What makes this especially frustrating is that many people have already tried allergy tablets, cough drops, nasal sprays, or cold medicine. Some treatments may help temporarily, but the problem often comes back. The reason is simple. What feels like mucus or phlegm in the throat does not always come from the same source. Sometimes it is drainage from the nose. Sometimes it is irritation caused by reflux. In other cases, the problem may be related to dehydration, dry air, mouth breathing, medication, smoking, or the repeated habit of clearing the throat. Quite often, 2 or 3 of these factors are happening at the same time. Today, I want to help you understand the patterns behind this common problem. This is not about diagnosing yourself from a video. It is about recognizing what may be irritating your throat, making safer changes at home, and knowing when your symptoms deserve a medical examination. The first thing to understand is that the sensation of phlegm does not always mean that a large amount of mucus is actually present. Sometimes mucus is genuinely collecting at the back of the throat. At other times, the tissues are dry, inflamed, or tense, creating the feeling that something is stuck even when there is very little mucus to remove. Both situations can feel almost identical. Both can make you cough, swallow repeatedly, or clear your throat. However, they may have very different causes. Let us begin with the nose and sinuses. Your nose naturally produces mucus every day. Most of the time, you never notice it because the mucus remains thin and moves quietly toward the back of the throat, where it is swallowed. When the lining of the nose becomes irritated or inflamed, however, that mucus may become thicker, heavier, or more noticeable. It can begin to drain down the back of the throat, creating the familiar sensation known as postnasal drip. Allergies are one possible cause, but they are not the only one. Cold air, dust, smoke, perfume, household chemicals, weather changes, and respiratory infections can all irritate the nose. Some people have a condition called non-allergic rhinitis, in which the nose reacts strongly even though no specific allergy can be identified. There are usually clues when nasal drainage is involved. You may also have a blocked or runny nose. You may sneeze frequently or feel pressure around the face. The symptoms may become worse during certain seasons, after cleaning a dusty room, or when you are exposed to cold air or strong smells. The problem may also become more noticeable after you lie down. During the day, gravity helps secretions move. At night, mucus can remain at the back of the throat for longer, which is why some people wake up congested and spend the first part of the morning coughing or clearing their throat. For mild nasal symptoms, a saline spray or a saline rinse may help loosen thick secretions and remove irritants. If you use a nasal rinsing device, water safety is extremely important. Use distilled or sterile water, or water that has been boiled and then allowed to cool. Untreated tap water should not be used for nasal irrigation, but suppose your nose feels reasonably clear. You are not sneezing, you do not have seasonal symptoms, and allergy medicine has made little difference. In that situation, drainage from the nose may not be the main explanation. The irritation may actually be coming from below the throat. Most people associate reflux with burning in the chest, indigestion, or a sour sensation after a meal. But reflux does not always cause classic heartburn. Small amounts of stomach contents can sometimes travel upward and irritate the throat and voice box. This is often called laryngopharyngeal reflux, or silent reflux. It is called silent because many people never feel burning in the chest. Their symptoms appear almost entirely in the throat. You may wake up with a rough or weak voice. You may need to clear your throat before speaking. You may develop a dry cough when you lie down. Some people describe a persistent lump sensation, as though a pill or a small object is sitting in the throat. Even though food and liquids pass normally, You may occasionally notice a bitter or sour taste in the morning. Your symptoms may become worse after a large meal, a late dinner, coffee, alcohol, chocolate, peppermint, fried food, spicy meals, or tomato-based dishes. The stomach is designed to handle powerful digestive substances. The throat is not. When even a small amount of stomach material reaches the throat, the delicate tissues can become irritated. The body may then produce more protective secretions, which creates the feeling of mucus or phlegm. This is why some people experience two symptoms that appear to contradict each other. Their throat feels dry and raw, yet at the same time, they feel as though there is too much mucus. The irritated surface feels dry, while the body continues producing secretions in an attempt to protect it. Reflux-related throat problems are often worse at night because lying flat makes it easier for stomach contents to move upward. That means the timing and size of your evening meal can be just as important as the food itself. Try to leave about 3 hours between your final meal and the time you lie down. Avoid eating a large dinner shortly before bed, and do not recline on the sofa immediately after eating. If nighttime symptoms are frequent, safely elevating the upper part of the bed may be helpful. Simply stacking several soft pillows under the head is usually not the best approach because it can bend the body at the waist and increase pressure on the abdomen. A properly designed wedge or a safe elevation beneath the upper end of the mattress raises the chest and head together. It is also more useful to identify your personal triggers than to eliminate every food ever associated with reflux. One person may notice symptoms after late coffee. Another may react to wine, chocolate, fried food, or a large dessert. Pay attention to the pattern. What you eat matters, but when you eat and how much you eat may matter just as much. Remember that symptoms alone cannot confirm reflux in every person. Several throat conditions can create similar sensations. If the problem persists, an examination by a healthcare professional may be necessary. Now I want to discuss something that many people unknowingly do to themselves dozens or even hundreds of times each day. That is forceful throat clearing. When the throat feels uncomfortable, clearing it seems like the natural response. It provides a moment of relief, so the brain learns to repeat the action whenever the sensation returns. But forceful throat clearing brings the vocal folds together with considerable pressure. Repeating this movement all day can leave the tissue swollen, sensitive, and irritated. That irritation creates another abnormal sensation in the throat. The new sensation produces another urge to clear it. Before long, you are trapped in a cycle. You feel something in the throat, so you clear it. The clearing irritates the tissue. The irritated tissue feels uncomfortable and may produce more secretions. Then you feel the need to clear it again. The original problem may have started with a cold, nasal drainage, reflux, or dry air. But repeated throat clearing can keep the symptoms going long after the original trigger has improved. Pay attention to how often you do it. Many people clear their throat before answering the phone, before beginning a conversation, after eating, while watching television, or whenever the room becomes quiet. Sometimes they are not removing mucus at all. The action has simply become a habit. When you feel the urge, try taking a small sip of water instead. You can also perform a gentle but deliberate swallow without making a sound. Another option is to breathe in slowly through the nose and breathe out through lightly pursed lips. This may reduce throat tension without slamming the vocal folds together. This does not mean that you should suppress a productive cough when something genuinely needs to come out. The goal is to reduce unnecessary, repetitive throat clearing that continues throughout the day. Hydration is another important part of this problem, especially after the age of 60. As we grow older, the sensation of thirst may become less obvious. Some people also produce less saliva. Others take medications that dry the mouth or deliberately drink less because they are worried about needing the bathroom frequently. When the body does not have enough fluid, mucus becomes thicker and stickier. Instead of moving easily, it clings to the back of the throat. A dry throat is also more sensitive. A small amount of normal drainage that would usually go unnoticed can suddenly feel like a large amount of phlegm. Hydration works best when fluids are consumed regularly throughout the day. One large glass of water at bedtime cannot completely correct a full day of inadequate intake. Warm water, broth, or caffeine-free tea may feel soothing and can help loosen thick secretions. However, some people with heart failure, kidney disease, advanced liver disease, or other medical conditions have been instructed to limit fluids. Those individuals should follow the advice of their healthcare team rather than increasing their fluid intake without guidance. The air in your home also affects your throat. Heating systems, air conditioners, and dry weather can remove moisture from the air. During sleep, you may spend 7 or 8 hours breathing air that continuously dries the nose and throat. A humidifier may help, but only when it is cleaned properly. Dirty humidifiers can spread bacteria, mold, and other irritants into the room. Change the water regularly and clean the machine according to the manufacturer's instructions. Do not make the room excessively humid because too much moisture can encourage mold growth and dust mites. Mouth breathing can make nighttime dryness significantly worse. Your nose warms, filters, and humidifies the air before it reaches your throat. When you sleep with your mouth open, dry air passes directly across the tissues for hours. Nasal congestion, snoring, jaw position, and sleep-related breathing problems may all contribute to mouth breathing. If someone has noticed that you snore loudly, stop breathing during sleep, wake up gasping, or feel unusually exhausted despite sleeping for several hours, speak with a healthcare professional. Those symptoms may suggest sleep apnea and should not be dismissed as a simple mucus problem. Your medication list also deserves attention. Certain blood pressure medicines in a group called ACE inhibitors can cause a persistent dry cough or tickling sensation in the throat. Examples include lisinopril, ramipril, enalapril, and benazepril. The cough does not always begin immediately. It may develop weeks or even months after the medication was started, making the connection easy to miss. Do not stop a blood pressure medicine on your own. Suddenly changing treatment can be dangerous. Instead, bring a complete medication list to your doctor or pharmacist and ask whether any of your prescriptions may be contributing to the cough or throat irritation. When a medication is responsible, a clinician may be able to recommend a suitable alternative. Other medicines may cause dry mouth and make secretions feel thicker. These can include some antihistamines, bladder medications, sleep aids, and certain medicines used for depression or anxiety. The correct response is not to discontinue necessary treatment without supervision. The correct response is to review your entire medication list with a qualified professional. Over-the-counter products can sometimes make matters worse as well. Some older antihistamines may reduce a runny nose but also dry the throat and thicken the mucus that is already present. Certain medicated decongestant nasal sprays provide fast relief, but using them longer than recommended can cause rebound congestion. When the medication wears off, the nose becomes even more blocked, encouraging repeated use. This is why you should always know what type of nasal spray you are using. A simple saline spray is not the same as a medicated decongestant spray, and the instructions for safe use are different. Smoking and vaping can also keep the throat inflamed. Both expose delicate tissues to chemicals, heat, and irritating particles. Even occasional smoking may aggravate an already sensitive throat. Secondhand smoke can have a similar effect. Alcohol can contribute in more than one way. It may dry the mouth and throat, and it can relax the muscular barrier that normally helps keep stomach contents from traveling upward. You do not need to transform every habit at once. But if late meals, evening alcohol, smoking, dry air, and repeated throat clearing are all part of your routine, improving even 2 or 3 of those factors may make a meaningful difference. The most useful step is to begin noticing your personal pattern. When mucus is accompanied by sneezing, nasal blockage, or a runny nose, the nose and sinuses are more likely to be involved. When symptoms become worse after meals, when lying down, during the night, or first thing in the morning, reflux may be contributing. When the throat feels dry and sticky, particularly in an air-conditioned or heated room, hydration, humidity, and mouth breathing deserve attention. When the main problem is a dry, persistent cough, review your medications. And when you find yourself clearing your throat throughout the day, remember that the clearing itself may be preventing the tissue from recovering. Many people will recognize symptoms from more than one category. That is common. You may have mild nasal drainage combined with reflux. You may have dry air combined with mouth breathing. You may have recovered from an infection but continued irritating the throat through constant clearing. This is why one medication or one home remedy does not work for everyone. Over the next 2 weeks, pay close attention to when your symptoms occur. Notice whether they are strongest after eating, during conversations at bedtime, or immediately after waking. Observe whether your nose is also blocked. Pay attention to changes in your voice, whether you sleep with your mouth open, and how often you clear your throat. Review your medication list with a doctor or pharmacist. Drink regularly if you do not have a medical reason to restrict fluids. Avoid lying down soon after meals. Reduce unnecessary throat clearing and replace it with a gentle swallow or a sip of water. These observations can also help your doctor. Saying that you always have mucus provides limited information. Explaining that the symptoms appear after dinner, worsen when you lie down, and are accompanied by morning hoarseness creates a much clearer clinical picture. Most persistent throat symptoms are caused by manageable conditions. However, there are warning signs that should never be ignored. Seek medical attention if you cough up blood, even if it is only a small streak. You should also be examined if swallowing becomes painful or progressively difficult, if food repeatedly feels stuck, or if you begin choking during meals. A voice that remains hoarse for longer than 3 weeks should be evaluated, particularly if you currently smoke or smoked in the past. Unexplained weight loss, a new lump in the neck, persistent pain on one side of the throat, difficulty breathing, chest pain, fever, or foul-smelling colored mucus also require professional attention. These symptoms do not automatically mean that something serious is present. They simply mean that home treatment is not enough and a proper examination is the safest next step. The main lesson is that throat mucus is not one single condition with one universal solution. Your nose, stomach, medications, hydration level, sleeping habits, environment, and the way you use your voice can all affect the same sensitive area. The throat is exposed to the air you breathe, the food you swallow, the drainage from your nose, and anything that travels upward from the stomach. Several different problems can therefore create symptoms that feel almost identical. Instead of repeatedly chasing the sensation, begin looking for the pattern behind it. Keep your throat comfortably hydrated. Treat nasal congestion safely. Avoid lying down shortly after eating. Reduce unnecessary throat clearing. Review your medications with a professional rather than changing them yourself. And arrange a medical examination when symptoms persist or warning signs appear. The goal is not simply to silence a cough for a few hours or temporarily remove the feeling of mucus. The goal is to understand why your throat remains irritated and remove the factors that are keeping it that way. Once the strongest trigger becomes clear, the right solution often becomes much easier to find. Listen carefully to the pattern your body is showing you. Protect your throat from repeated irritation, and never hesitate to seek professional care when something continues to feel wrong.